Welcome everyone to today's webinar, Patient Collection Strategies in an Economic Downturn, One Community Hospital's Journey and Tips for Success. I'm Anuja Vaidya with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Mike Bile is Senior Director of Patient Accounts at Sanford Health. With 20+ years of experience, Mike has held various roles in revenue payment integrity, application support in IT, and financial services. With this diverse background, Mike has specialized in service process improvement, utilizing technology and Lean Six Sigma, focused on championing the optimal patient financial experience. I would also like to introduce Jason Considine. Jason serves as the Senior Vice President, Patient Access, Collections, and Engagement in Experian Health. In this role, he leads an organization focused on product management, development, consulting, and operations for solutions that enable healthcare providers to manage the patient financial experience. At this time, I am pleased to turn the floor over to Jason to begin today's presentation.
Thank you, Anuja. It's my privilege to kick us off today. I'm going to go through the agenda to start. We're going to spend just a few minutes talking about the impact COVID-19 has had on our industry and patient collections in general. Before I turn things over to Mike and give Mike the opportunity to share with you Sanford Health's journey and how they've been optimizing their patient collections organization and more specifically in response to COVID, redeployed their call center representatives into a work from home environment to make sure that they can thrive in the operating climate that we're all dealing with today. And at the end of Mike's presentation, we're gonna leave some time for some Q&A. So as everybody's very well aware, we're operating in what are certainly unprecedented times, and we're faced with challenges that we've never seen before. There are surveys that are saying that hospitals and healthcare organizations are going to lose in excess of $200 billion this first quarter that we've been dealing with COVID. And elective procedures and the cut of the elective procedure volume is really driving that. And the survey studies are saying that we could see up to 40% losses continued as different pockets of the country are dealing with lower than normal elective procedure volumes. It certainly impacted our jobs as well. Across the country, we're seeing record unemployment, and that's no different in healthcare. We've seen customers that have had to furlough employees, lay off employees, and so the impacts of this pandemic certainly are reaching beyond economics and financial impacts and affecting the jobs of people in healthcare organizations. And when we look at what executives that manage health systems are predicting, this revenue decline or loss as a result of the things we just mentioned are likely going to impact us through the end of 2020, and we'll see revenues in excess of 15 to 30% in decline as we exit this year. And so unprecedented times, and Mike and Sanford have done some pretty phenomenal things to manage through that, and really excited for him to be able to share his story today. Before I turn things over to Mike, I wanted to take a second to acknowledge the incredible commitment of the healthcare community to go above and beyond in the battle against this COVID-19 pandemic. Experian, as a global company, we've joined efforts around the world with healthcare providers, governments, nonprofits, financial institutions, small businesses, and consumers to help wherever we can. And as a result of that, we've seen firsthand the selfless and tireless heroics that healthcare organizations and you all that are on the phone today have done as a part of your everyday work to help our country and the world respond to this. And I didn't want to lose sight of the fact that this is still very much a real part of our everyday lives, and use this opportunity to say thank you and acknowledge how much we appreciate everything that you're doing. And with that, I'd like to turn things over to Mike Beyer.
Thank you very much, Jason. It is, as you said, my name is Mike Beyer. I'm the Senior Director of Patient Accounts here at Sanford Health. We're located up in the Dakotas. We've headquartered out of Sioux Falls and Fargo. We're really kind of a joint venture with that. We are a community-owned and private, not-for-profit charitable with a volunteer governance. Our boards are all volunteers that support our organization. As it states that we are the largest nonprofit, mainly by square mileage, because we do take up a large footprint in the upper Midwest. And we do provide care, though, beyond that with a recent merger with the Good Samaritan Society. Now we're in 26 states and 9 countries as well with our World Clinic organization that we do have. So I'm honored and excited to be able to share the Sanford story with those of you who are in attendance today. As you can see, the Sanford footprint, as I kind of stated, we're in those 26 states and also the other countries, the 6 countries we're in there. Just to give a little background, a little statistics from the organization, we do have 44 medical centers. Annual revenue is about $6.1 billion. Using numbers from 2019, of course, little change in that with our second quarter or end of first quarter and beginning of second quarter here in 2020. But we do have over 400, almost 500 clinics, and then there's about 270 senior living centers. We also do have our own health plan, one of the organizations with that, and we do have about 190,000 plan members from that perspective as well. So as you can see, there's some additional statistics on that slide going on down, but I'm not going to go through each one of those in detail at this time. So really to tell our story, why did Sanford really partner with Experian Health? Really for multiple reasons, but mainly we needed a way to increase our self-pay receivables, and also balance our uncompensated care, which is our charity with our bad debt. We also carried it on to the stage 2, where we really wanted to redesign our call center. And beyond that, we were looking for a single vendor partnership that we can take care of really all of those aspects. We were really working in an environment with a lot of manual processes, and we wanted to be able to automate some of those as well. And of course, not last but definitely not least, this is mainly in our forefront, we want to improve the patient experience as we do put the patient in the center of all of our activities that we do, because without them, we really do not have an organization. So Sanford Health, where our journey began. Kind of a look back at what life was like in our office prior to implementing and merging with our partnership with Experian Health. We had 120 call center employees, but they were scattered throughout our various locations based upon where they were at the time when those systems and those locations came to join the larger system known today as Sanford. We had 4 business offices, main business offices, one in Bismarck, North Dakota, one in Sioux Falls, South Dakota, one in Fargo, North Dakota, and one in Thief River Falls, Minnesota. So as you can tell, we're kind of spread out throughout the upper Midwest, almost to the far reaches there. And as you can imagine, bringing those on, they each had their own telecom providers. Not the same system all the way across. They each had individual ones. They each had their own toll-free and local phone numbers to get into each of those business offices. And they each had staff at those offices to man those volumes of calls that were coming in. With that, patient collections was manual. We are an Epic shop. We're working out of the Epic system, and one of the things, we've been with Epic since 2005, so we're just going on 15 years now. But we work mainly out of, for the patient collection side anyway, out of work queues. And we basically do those by alpha splits and work those individuals and assign work queues to representatives based upon those alpha splits as well. Our contact centers at that point in time were really managed separately, but they were consolidated only in reporting, not in call routing. And we had high abandonment rates in one of the centers while the agents were waiting for calls in another center. It just was not a good situation. So we're really looking at being able to balance that. And we were making minimal outbound calls, even though we had the work queues there available for our staff to pick up and call on those. They really were focused on answering those inbound calls. We do have an integrated customer service and collections team, which they do both, because once you resolve their customer service issues, it makes it a lot easier to focus on the collections. So kind of looking at some quick statistics here. As I stated, we are a blended call center, but our reps were really focusing on those inbound calls. We've always stated that our inbound calls are our priority. We want to be there for our patients when they're trying to contact us, but we also need to balance that with contacting them to remind them and provide that little prompt to let them know they have a balance that's outstanding. What can we do to help you resolve that balance? So you can see we did have some call statistics there. We did utilize a single messaging service where we'd leave a blast telephone message to them, but it was not integrated, so the only thing they could do was get a phone number, write it down, and then call us back. So I'll talk a little bit more about that when we get into the implementation and talk about a little bit about the link back options. With that, though, prior in 2014 and prior to that, we did have, as most call centers do have, not to this extent, but they do have turnover because working on the phones, working with people every day is a very challenging position. We did have employee turnover in the upwards of 58% that year, which caused us to really take a look and really focus on some dramatic changes. The other thing I wanted to point out from here is you can really see that our charity was just a fraction of what our bad debt was for that, and we really needed to find a way to balance those numbers to really balance out our uncompensated care for the organization. We knew at that point in time we were sending things to bad debt that probably shouldn't be going there because the patients couldn't afford it. They were just either too proud or there was other inabilities for them to get a hold of us and really talk through that and show us that they weren't able to, and our only option for charity at that point in time was strictly looking at the applications that were submitted to us. So our road to collections optimization and implementation results. So this is kind of post-implementation. What did we see? Well, as we look at the timeline for our journey, we really did the RFP for the solution we're going to look at back in 2013 and into the beginning of 2014. We did make our selection in the first quarter of 2014 and worked with Experian to get that contract in place. Contract was in place around April, and we went live with our segmentation and our scoring of the collections optimization by August of that same year. So within 4 months from contract to really go live of our first phase of that. The next phase really rolled us into 2015, the first and second quarter of 2015, where we really looked at the other screening tools that were offered with the package of the collections optimization. That's really return mail screening, helping us find some of these addresses when individuals have moved and we don't have the updated information in our system because they haven't either been back for a service or they didn't bring that information forward at the time when they had their last appointment with us. We also were able to find some patients who we may have outstanding balances and scrub those for when they've deceased, and we can kind of take a different route with those, a different approach. We do need to handle those slightly different than our mainstream accounts that we do handle through our organization. The other piece of it, of course, was the bankruptcy. I think there were statistics going on back then where healthcare was the driving factor for a lot of patients who were filing for bankruptcy. And of course, they don't always want to let us know that they've done that. So we really were able to use this as really a safety net solution for us to make sure that we weren't missing any of those and still sending statements out and in essence then violating the stay that's required of us by not contacting them when some of those balances really truly are included in that bankruptcy proceedings. Also in 2015, really towards the end of that, December 1st was the exact date, but we did move forward with the patient dial solution, utilizing the dialer, which was really the true need. With that, we had some abandonment rates in one of our centers that was upwards of 40 to 45% on a consistent basis, because we had a lot of volume going there driven by the contact information off of our statements, but we didn't have a majority of our staff in that location. They were still spread out. We definitely had enough people to handle the calls, but our true purpose of moving to the patient dial at the onset of it was really to load level those calls and get the calls to any of the representatives at any of our locations, and be able to answer those questions, answer those calls, help those patients, again putting the patient back in the forefront of really what our purpose for being here to help them is. Beyond that, then moving into 2016, we did take that patient dial solution and start with some of our outbound call campaigns. We did that in March, but we also took the other side of it with the scoring and segmentation and moved into a presumptive charity or presumptive financial assistance model, where we were then able to start. We recognize and we have reason to believe that these patients were not able to pay their bill, and they didn't have the means, and they weren't going to do that, but they may be too proud, or there may be some other factors that are causing them not to fill out an application for us to apply for that. We could basically move those balances to a charity or a financial assistance position, benefiting the organization, also providing us and allowing us to be a better partner with our third-party collection agency vendors, so we're not giving them accounts that in essence are uncollectible. And also it's helping us kind of reduce and balance that uncompensated care from bad debt and charity, as we talked about on the previous slide. Efficiencies gained, kind of looking at some of the scrubbing tools, and then also looking at the charity at the very end, of the charity and bad debt. The return mail, we were able to get new and improved addresses. As you can see there, we had almost 170,000 new and improved addresses. When we get those updated addresses, it saves us on our return mail accounts. It also helps make sure we're getting statements out to a correct address, and helps us to generate the payments. With some additional assistance from the partnership we have and the consulting group we have with Experian, we're able to kind of zeroed in on this number of the $2.5 million since we've gone live, and it's really a savings on that statement savings, and then FTE savings of about 4 FTE. Looking at the patient satisfaction also, because accounts were avoiding going to bad debts, when we were getting return mail, we could find that updated address before we would send anything over to an agency if we needed skip tracing done. You can see there we did have almost 2,800 deceased guarantors that were identified. We were able to generate payments off those, really balancing that, whether there's a surviving spouse or not, or anybody else who would be responsible for payments on those, before we would look at any type of probate extension, et cetera. So again, there's the value of that, some statement savings and some patient satisfaction, family members being handling those calls a little bit differently when we have those identifications come through for us. Looking at the bankruptcy, that really does kind of speak for itself. We were able to make sure we were really as that safety net, making sure that we're not stepping into any issue that we don't want to by trying to collect on something that is part of a bankruptcy filing. Got that as our safety net to make sure we're going to mitigate any risks. We can really focus our collection efforts on collectible accounts. We can pull these out of the mainstream and really be proactive about it versus reactive. So, and as I talked before about the charity and bad debt, we had over 10 million accounts adjusted to charity, over 830 million accounts awarded to charity, which was an increase of 1%. Bad debt was dropped down to 756,000, so that was a decrease. We were able to really shift that balance, or that percentage anyway, from the bad debt to the charity, and making sure we're taking the full advantage of that as a non-profit organization. But it also reduced that manual intervention, and it reduced that lack of the charitable piece of that for the community benefit, for Sanford as an organization because we weren't missing that any longer. We're really able to take advantage of that even though we may not have a hard and fast application in front of us. Kind of looking at the call center gains. After we're consolidated now, we're managing the call center at about 115 representatives across. Not all of those are phone reps because there are other functions that we do now with that, but we're able to take basically every single toll-free and direct dial number from this and really direct them or port them to the patient dial solution. And no matter whether I'm in Bismarck, North Dakota region and calling the local Bismarck number, or if I'm in the Sioux Falls region and calling the local Sioux Falls number, it's going to get into that pool where any representative who answers that phone is going to be able to help me. It's really a great technology, and we really use that cloud-based solution, so it doesn't matter where they're sitting on that. They can answer those phone calls, answer those questions, and really and help that patient and really carry them along their journey of whatever is ailing them or the reason they're seeking Sanford for services at that time. We did also do some redesigning of our patient statements, which really helped us highlight that and update us into the new age of being able to present that information to the patient. We're constantly looking and receiving feedback from our patient base to make sure that the statements they're receiving are, one, informational and understandable, and two, does it give them the information they need to make a payment? Does it give them the information they need for financial assistance? We make sure we're communicating all of those things to them so we can help them through the statement find the resolution that's most beneficial to them and their personal situation. It really personalizes it for them as well. We also did, to really combat a lot of the turnover rate we had with employees and the employee satisfaction side of it. Anyone knows that in a good organization, if you take care of your employees take care of your, in this case, patients or customers. So we really wanted a good way to really take care of the employees who were doing what we really wanted them to, and we're really applying the right reward for the right actions taken by our representative staff that are answering the phones and helping our patients, or whether they may be working with financial assistance. We really wanted to bring that all together, and we did move in the direction of implementing in early 2015 a collections incentive program for that, and it really we were able to really turn that around. Since 2015, the highest turnover rate that we have had on a yearly basis was 8.2%, which for me, I consider that a big win because it costs a lot to replace an employee, it costs a lot to train an employee, and it also interrupts a lot of the other things that we want to accomplish as an organization when we bring in those new representatives to train them and bring them up. As we all know, healthcare is not simple. We definitely want to focus on what we need to and give them the right tools to be successful and also be able to appropriately handle any issue brought forward by a patient and get them down the right path to resolution of their issue. The phase 4, we did start this about 2.5 years ago right now. Actually, I take that back. It's just over 2 years ago we started this. It was May of 2018 we started moving to remote workforce, which means with the patient dial solution, we were able to really get our staff the ability to work from home, work remotely from home, not have to drive into the office, not have to get out of bed, change their clothes. I mean, we expect them to be dressed appropriately from home, especially if they're on any calls with us. But from that perspective, I mean, they don't have to make that commute to work every day. And this has been a huge satisfier for our employees as well. And it's also really aided in our ability to really keep some of these long-term employees that we have because they're able to continue to work, they're continuing to do those same types of functions from their home as they would have been able to do from their desk right here in our centralized office. Kind of some of the statistics you saw before was about 9,000 average inbound calls. Since then, due to some natural growth, but also because of some availability of our staff. They know they can get through to our representative. Our average speed of answer before was near or over a minute on an average basis. We're able to really cut that abandonment rate down to 1.5% on average, and we also have an average speed of answer of 20 seconds. Most times, that's an annual average. When we go through our peak season, tax season in the spring, we usually see that jump a little bit more than that in non-tax times, which is the time we're in now from really June through December. Our average is usually a lot less, probably closer to 14 seconds, but I really posted an annual average there, so you can really see that. What's the other results? We increased our patient satisfaction. They know if they're going to call, they're going to get a hold of somebody. They're not going to be waiting on hold a long time. They also know that we were able to really drive what our main purpose is, and that's to bring in that cash for the organization. And then we also were able to increase the employee satisfaction and retainment. As I stated, our turnover rate, the highest it's been in the last 3 years, has really been 8.2%, with a couple of those years lower than that, but I really wanted to point out 8.2. So this is kind of a very busy slide, but I wanted to kind of point out the strategies that we implement, and I want to tell you right up front, this looks a lot different than when we first started with our program. One of the benefits we really looked at is how we're able to really partner with our consultants from Experian and continue to tweak that at a very minimum at a biannual basis. We continue to look at the strategies, make some changes. We look at what our collection rates are per segment. We look and maybe we focus on some additional unattended dialing to some of these patients at an earlier date. Maybe we look at leaving this. One of the biggest things I really do want to point out, and one of the biggest benefits that I've heard from this is really those individuals who really self-procure, self-take care of their balances. They really don't want us to ever interact with them. If they ever get a call from us, it's almost offensive. Those are the ones that really fall into that segment 1s and 2s. And with this, we can really kind of leave them be for the earliest period of time and let them take care of what they need to do to get their balance resolved, and then only jump in later on in that cycle if it's something they haven't taken care of. It's really a conversation now that, Mr. Jones, usually you take care of this, and we want to make sure there's not an issue. What can we help you with today to take care of that? And then we find out if there is an issue that's causing them to really draw back and hold back on that and focus. But so we go down the different ones. We do get the two different values from the Experian segmentation, and that's going to be a segment 1 through 5. We also get an estimated income level, which could be anything as a percentage of the federal poverty level, and we really gauge those two together to really drive some of our automated processes, drive our campaigns, and really which ones do we focus on. Do we go with the blast messaging or the unattended messaging, or do we go with a preview call to them? One of the things that Sanford has really done is really focus on making sure that when we call out, it's a 1-to-1 ratio, and that representative is there waiting for that individual to answer, and if they don't answer, we leave them a personal message, of course, HIPAA compliant message. When we leave that message for them to give us a call back, and we can then take it on that return phone call. The other thing we did focus, I kind of mentioned back in March of 2016, we started working with our patient dial campaigns, really focusing that first year on making sure we had the good level of our major just collection calls. We've now moved to a stage where we're always looking for bigger and better and continuing to move things from manual to automation. And one of the things that we've done is in the highlighted, darker highlighted there, you can see we had the unattended campaigns with the link back. That was a great thing. We were able to kick out those automated messages, and if we were able to reach somebody and they wanted to speak with somebody about it right away, they could press 1 and be routed directly into our call center as an inbound call. The other was the preview campaign, as I just stated, with our staff calling out. But since then, we've also done that. If we have any questions on applications that have been turned in, we can we have a campaign now that we've pulled together to call out and ask the patients those questions about the missing information we need for their application. Or if we're getting return mail, in the new age with everybody having more cell phones and landline phones at the homes are going away more and more every day. When they change addresses, in most cases, they don't always change their phone number. So we can reach them on their phone. We can get that updated information and get the statement generated off to that. We do create a campaign for that as well. One of the other things we also do is when we get those coordination of benefits denials from our insurance carriers, they may feel that someone else is responsible for payment of the bill outside of them as the insurance carrier. We can do that coordination and reach out to those individuals and try to get a hold of them to prompt them to get in contact with their insurance company to make that connection and get things squared away so we can get the proper payment to us so the balance doesn't roll to them. We've also set up some what we call work queue automations, and that's where we pull out, if we do have through the Epic system, we can save tokenizations of cards and make installment payments through the system. And we have those cards that are coming up for expiration. We can make some call campaigns to get updated card information. If they've been on a payment plan, maybe not an automated payment plan, but they've been on a payment plan, we can reach out to them and update if that payment plan is broken. Another feature that we do have, we aren't able to automate this for other reasons within the organization as far as our legal standpoint, but we do contact them when they have a payment plan that's existing, but they have new services that aren't yet added to that payment plan. We can reach out and get their confirmation to add those balances in. Just kind of showing some of the statistics. This graphical does show, really, we wanted to flip that charity, that bad debt portion of it, reduce the bad debt and increase our charity, really leveling that out. We can, as you can see there, we brought that down, the bad debt down, and the charity remained relatively flat for the first couple years, and then we were able to really drive that switch there. This is kind of the same thing, only it's in a percentage of our revenue. As a percentage of revenue, this paints really the picture that we try to do right away, and that is get that switch from a lot of that bad debt going more now being classified as charity right away, and then really seeing that trend line. You can kind of see also the trend line of the natural growth of our volumes as we continue year over year. With our partnership, looking at the key contributions or contributors to our increased revenue, really I have to say a lot to the patient dial system. I mean, we had some staff that were, oh no, I'm not going to work on a dialing system, and now it's that those same staff were saying if we ever have any issue, which is almost never, if we have any issues with the dialing system, they're going to be, come on, we need to get this fixed so I can get back onto my calls and keep that going. They really want to focus on speaking to those patients, members, and making those cash collections. We also were able to kind of screen and remove some of those uncollectible accounts, as I talked about before. And really, I think the employee incentive program is a huge driving factor as well. It really puts the right reward for the right actions of our employees and really benefits them personally, which helps really drive them to do the right thing for our patients as well. There is a quality component to that from the call recording aspect of the patient dial solution that we do have as well. We quality select different calls that they have to make sure that they're providing the quality service. If they ever have a situation where they are not providing the optimal patient experience for one of our patients, they do lose their incentive for that time period. So it's very critical that we're making sure that they're providing the right service for our patients and not out there mistreating the patients just to get the cash in the door for the organization. It's really putting that focus on that patient experience, putting that focus on and putting the patient as the center of that focus as well. We did automate the presumptive charity, once again keeping some of those bad accounts out of there. We're able to also see some savings from that by not having to continue to send statements on something that we can reasonably believe the patient does not have the ability to pay, and move forward with that as well. And as I stated with the consulting group with Experian, that high level of partnership engagement, just to make sure we're continuing to manage our workflows, to manage our drive and what needs to happen with our swim lanes on those different segments, to continue to push the bar and make it optimal for the collections that are coming in for the organization. Patient payments, first year implementation, you can kind of see we really leveled out and were able to continue to push above and beyond the previous years. But as we look then going for the 2017, 2018, and 2019, the goal has always been to continue to increase our payments this year over the same month from last year. Some of these things do skew a little bit depending on when the beginning and end of the month falls each month, but for the most part, we're able to really continue to push that envelope and continue to rise and meet the challenges year over year to make sure we're really showing that improvement year over year as well. Collections during the pandemic. Some of the challenges and strategies during the pandemic, when this hit, we were already in a very optimal position when the pandemic hit, because a lot of the things that we're really afraid of at the time when this started, probably back around the middle of March, is what if I get it? How do I present myself from getting it? You get it from being around other people. How do I get to the point where I can continue to work but not be around other people? And it's really getting them to work that remote work location, or working from home, working from their home office. Some of the challenges we faced at that time were really not with the patient dial system, it was more internal. We had to access a VPN, had to receive VPN access for each employee in order to have them be able to access the Epic system from home. But that was really what drove some of the delays of getting those individuals to work from home. That and the fact that when we did send our employees home, they had to basically pack up their computers, desktop computers, monitors, keyboards, mouse, and their machines for taking payments, and put them in a box, take them home, and then reset them up on their own. We did have some of our IT technology solutions representatives who were able to, by phone, try to walk them through setting up if they had any issues. Fortunately, we did provide them with a very good workflow to set those up and make sure that they were, for the most part, able to do that on their own. We also made sure we had to stagger some office departures so we didn't leave our patients hanging there as well. We did continue on through our normal process of contacting patients, really from a perspective of how you doing, what can we help, and we do still show the balances outstanding here. What's your position? What do you need to be doing from that perspective? So from that, the patient dial agent gateway was a seamless transition for the team to work from home. From a management standpoint, we were able to monitor them whether they're working from home or working in the office. On our screen that we review for those that are on the phone system, it's exactly the same. It doesn't tell us that they're working from home. It just tells us their statuses as they're working, and we can continue to monitor them as if they were sitting in the next row over from us, right in our business offices. So what did we do? We did transition. Before COVID hit, our staff, we had about 30% of those who were working remote. We did transition that to just shy of 99%. We had our call center representatives working from home. We had a few new hires that were still in training that we had to keep back. But from that point, we really were able to transition a majority of our up and running phone staff to a work from home position. Another thing that Sanford did is we did create billing indicators so we were able to identify patients affected by COVID, or if they had a COVID test. We continue to monitor those at this point in time as well, and we're able to really see those with our call campaigns to make sure that if any of those do come up, we can really focus and make sure that everything is okay, especially if they've been personally affected by the virus and the pandemic as well. Another thing that really helped us along the way, Experian was able to provide us with a weekly file for anybody who may show signs that they're financially stressed. Maybe they've been furloughed from their job and they're out of work, they're not making the funds they were making before. We can certainly take that. One of the things that Sanford as an organization, again, keeping the patient at the center, is we really wanted to focus on them, helping them along and really showing them that, yes, we can either defer a month's payment, or we can extend those payment plans, or we can skip a payment on the payment plan and re-age that for you and really help you get through this time, especially at the beginning, not knowing how long this pandemic and the shutdown would really last. So we really maintained the call center through that, really to be there as a resource for those patients who may be experiencing that. We also did use the metrics right along with that patient dial solution. As I kind of stated, the metrics stayed exactly the same for them, whether they're working from the office or working from home. We did continue to use our staff and have them with our leads and our supervisors being able to listen in to some of those calls. They could also coach some of the newer people as they're taking those calls. They can do that whether they're in the office or whether they're working from home. If we have a difficult call, we do have what's called the barge technology, or really taking over that call, and our dashboards still look exactly the same no matter where those representatives are sitting. So really, what changed as a result of COVID? Really, from our perspective, we did have low census within our face-to-face business offices. We actually closed those down. We were able to repurpose a lot of those staff and have them working some of our work queues on our correspondence side of things to really keep them active and engaged. If they had been, which all of them have been trained on the phones, we did pull some of those and put them back into the call center environment, so they're able to take some of those calls, make some of those outbound calls, really helping coach those patients along the way. Only our clinics continue to see the face-to-face staff. Our revenue did decrease. Of course, I think a lot of it, as Jason had indicated before, a lot of the health systems did see a decrease in revenue because of this, as we were prepared, not knowing what was going to happen and how many potential hospital beds were needed if we had a surge of COVID patients. Our central business office did have an increased contact rate, though. One of the positives of the pandemic, with a lot of people going to work from home from the businesses in the upper Midwest region here, with them being at home, we were able to make a lot more contacts of people and really work through that. I think another thing, looking at it from this perspective, with the incentive money that was paid out, or the stimulus money, a lot of those people did utilize those to really reduce their balances they had with Sanford, since we were making the effort to continue to contact them and really drive that balance down. And as I said before, that financial stress report from Experian Health helped us really focus in on those individuals, really say that maybe now is the time we work with you, maybe that's a charity piece, maybe that's a deferral of requirement of payments for a couple months. We really could drive that and really be in the seat to show that patient exactly what we wanted to do to help them along. So what we did see, though, one of the results, our collections did decrease for the first time in the last 3 years, month over month, but with the exception, that started in April. In March, we still had inside collections. We set a new monthly record, and we were over the past monthly record, which is March of 2019, again, tax season. But we were able to exceed that by a marginal $800,000 cash collections for that month. But we still, again, that's our record-setting month. So year over year, the cash for the months, if we look at it as a group from January to June, we still were able to increase our total cash from January to June in 2020 over January to June in 2019. Our employees, looking at the other factor, again, take care of your employees. They'll take care of your patients. We did have a 99% staff retainment, and team members were grateful to remain employed. I think staying away from the non-friendly furlough word. Looking at some of the last reports here, just the patient payments, you can kind of see that continue to trend year over year. We did drop in April, May, and June, but as a group overall, we still are ahead of the game from 2020 compared to 2019. When we add in our agencies as well, our agencies did see some similar trends when they were reaching out to our patients, so they were able to see the same type of thing. So what contributed to this? I kind of mentioned a lot of these before, but really the patient dial and having that ability to contact those patients, the segmentation scoring, really focusing on those who have the ability to pay and working with those and getting them to a resolution maybe outside of a payment for those who don't have the ability to pay. As I stated before, the tax season and stimulus checks helped us keep it in the upper range there. And then really our investment in our strategy, working continuously at least biannually to update that strategy and really focus on where we need to go to continue to push the envelope for those. Overall lift since our go live back from 2015, we do have a sizable increase. Of course, some of this does contain some organic growth, but continue with that, it's still a sizable lift overall. And on that, open it up for questions and discussion. I'll turn it back to you, Anuja.
Thank you, Mike and Jason, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. We have a couple of questions coming in here. So let's begin with this one. The question is, when you started your journey with collections optimization, did you evaluate other vendors? If so, can you speak to the other solutions you looked at?
Yes, we did evaluate several solutions before we did make the selection to go with the Experian tool. I think when we narrowed it down from the various vendors, we got it down to 3 different vendors that all did provide a different type of scoring solution. And as we reviewed each through the vetting process, we sought out a solution that really required the minimal lift from our own internal technology solutions department. I think as most healthcare systems know, the IT resources that it takes to really integrate and implement some of the different tools that we want to use as an operations team, there may be some heavy lifting that's required by our IT team, and we really wanted a solution that wasn't going to require that heavy lift for the technology solutions IT team. So we focused on that. That was a big piece. The other piece of it was we were new to this. We didn't know exactly what we wanted to do with the scoring and segmentation. We knew what we wanted to get to as far as it impacts our patients, but we really wanted that consulting that really is going to help us along the way and basically help teach us what we didn't know. And from that 2 aspects, that's really why we have made the selection to go with Experian over the other solutions that we had. A couple of those gave us the segment or type of scoring, and it basically said, here it is. If you want it, that's how we present it, and you can do with it whatever you want. And that's really not what we wanted. We wanted guidance on how to continue to move forward with that.
Got it. Thank you so much for providing those insights. So another audience member said, I'm curious about the incentive program. How has that changed during COVID? And how do you ensure reps are being empathetic to the current financial crisis for many patients if they are incentivized to always collect payment rather than find other options?
Very good question. We do have a very stringent quality and assurance program throughout our organization, and we do have very strict that if anything that's monitored throughout any of the calls that they may be on, and it is sets that negative tone for the patient, we do remove that incentive. That's the very first thing that is on the list to go if there's anything that negatively impacts any patient that we do have. We followed that true. We've been with that since day 1 of the go live. We can't have one without the other. Our patients have got to maintain that and be first and foremost with that. So that is our focus. Our patients are our focus, and you take care of the patient like that, and this is really the culture we've built around our entire program, is that you take care of the patient, you really help them and find resolutions for them. The rest falls in line, and that's really what we find. If we have anybody in the past, and I will say that we have had individuals in the past who have gone that more strong route, and they do not last in our organization. They, as I stated, they don't receive their incentive program when that happens, and they usually end up looking for other options outside of our organization because it's just not the culture that we have. We don't tolerate that. We never have, and we never will.
Absolutely. Thank you for that detailed answer. So our next question is the barge technology or service provided by Experian?
It is provided by the patient dial solution, yes. That's really with their partner that they have with the patient dial solution. The barge technology is an option that is available there, and we do have it. If we have a call that we may have an individual caller who is getting out of line, the supervisor is able to basically go in, interrupt that call, and take that call over from the representative and let them go on to a different call, and really help that bring that patient from an escalation back down to where we need them to be, and help them with their issues and get them where they need to be to get that issue resolved. So that is a tool that is there. Do we use it a lot? No, but it is available. We do use it, and we have used it in the past.
Great, thanks for clarifying that. Our next question is, how did Sanford operationalize the financial stress information, that is custom / focus statements, special dialers, etc.?
We did mainly keep it within the special call campaign. When we had those types of callers out there, we really reached out to them. We would really focus that call on, we understand you may be going through a time. Can you expound on that? It really the thing that changed was our script and our approach to how we really worked with them to find a resolution that was going to be beneficial to that patient. Of course, still beneficial to Sanford as an organization, whether that's still making payments. We did really look towards kind of a tiered process. We would first say, is your situation going to be long-term? Is it short-term? If it's short-term, maybe we first look towards waiving a monthly payment if they're on a payment plan, or maybe we're looking at if they normally pay the balance in full, maybe we say we'll let you skip this month, you can pay the balance in full next month, and not age that account to the point where it would go through our normal automated collection process. That would be one focus. If it was long-term, we would potentially turn down our route for financial assistance and really see where they would go there and get an application in their hands. Generally, if they're at that point, when we look at the scoring and segmentation updates, we do review those once every 60 to 90 days. And it may, because of how fast these things happened, it may not always pick it up right away, but it would catch up with them usually before those balances run out. So we really wanted to get out in front of that, be proactive, and really work with those patients from that perspective.
Fantastic. Thank you so much for that. Our next question is, what qualifies an account for presumptive clarity? What guidelines are used? I'm sorry, presumptive charity.
Presumptive charity. We do utilize that inside the collections optimization tool. We do have the segmentation out there of 1 to 5. 1 being those patients who always pay their bills. 5 being those patients who never or rarely pay their bills. And what we really looked at from that, mainly focusing when we first began on those segment 5s, we also used that second. I kind of talked about that, the second piece, which is their estimated income. You still could have a significant income and still not pay your bills. It's just the way some people are. Those would not qualify for the presumptive charity, but if their income, if we can reasonably believe that their income was low and we could see that they weren't able to or hadn't been paying their bills in the past, we could qualify them for the presumptive charity. Now, one of the things we also did do internally at Sanford to make sure that the scores were calibrated is we do on a quarterly basis check against 100 applications each quarter the same scores and segmentations that fall in our system. Of course, there's a few outliers, but for the most part, the scoring is matching up with the same information that those patients are presenting to us on their applications that they're submitting. So if it falls below that certain, based upon our financial assistance policy, and it's a segmentation of 5, or later on in the cycle of 4, so we do use it for 4 and 5s under that certain estimated income level, we will qualify them for presumptive charity.
And this is Jason.
I'm sorry.
Wanted to add one thing to Mike's answer there is that when we partner with customers to implement these different workflows, every customer's policies are a bit different, and the tool's customizable, and so the rules that Sanford may have in their presumptive charity and charity policy program rules can vary from somebody else's, right? And it's important to understand the platform has the flexibility to configure this differently based off the rules of each organization and evolve with you as your presumptive charity processes may change.
Got it. Thank you both for those insights. We have time for one more question here, which is, are you embedding both inbound and outbound calls into the Epic encounter?
I'm sorry, could you repeat that?
Sure. The question is, are you embedding both inbound and outbound calls into the Epic encounter?
I'm not sure what they're meaning by embedding those. We do receive those calls, and with the way the patient dial interacts with our outbound calls, it'll automatically integrate and pop up the account that's being called on an outbound call. On an inbound call, our staff will implement the account information. But yes, everything that we do get a note feedback with those dispositions from the patient dial system, and they are brought back through Experian into the Epic system through a note feed on a daily basis. I think that's what the question is. If I'm misunderstanding that, I may need to have a clarification on the question.
Well, thank you so much for providing that response. And with that, we're coming up against the end of our time here. So I just wanted to throw it back to Mike and Jason one more time to see if you have any final thoughts.
Just wanted to take the opportunity, Mike, to say thank you to you and your organization for taking time out of your busy schedule to share your story with the folks on the call. It's a great story, and you guys have made changes and are leveraging technology that have created, ability for you to thrive in this current environment. So thank you for your time and the presentation today. And thank you to everybody again on the phone, to you and your organizations for keeping us safe and helping keep everybody well. Mike, any final words from you?
Yes, thanks, Jason. I'm humbled and honored to be able to present our story. Being from the Sanford, the culture that we built around this and the culture we built within our own department, we really want to share that story and be able to take that. Now, this isn't our final stage, of course, because we want to continue. The biggest pieces of our culture is always driving onward and upward, and what's the next big thing that's going to help us. We have several things on the front that we're working on that's going to basically really drive some enhancements on how we can provide services to our patient, again, keeping the patient at the center of it all. So it's been a great partnership working with Experian and working with the consultant that works with us on a weekly, if not more frequent basis than that, because we do want to keep the momentum going and really focus on those patients and how can we make it better for them in the long and the short run. But for that, thank you.
And that is all the time that we have for today. I want to thank Mike and Jason once again for their excellent presentation and Experian for sponsoring today's webinar. To learn more about Experian Health, check out the resource tabs on the console. Enjoy the rest of your day, and we look forward to having you join us for future webinars.